Well, the South African scientific medical fraternity has not only been highly regarded for some time, but has been recently praised internationally for their ability to track the novel coronavirus and detect the new SARS-CoV-2 variant. Not to mention the rollout of the J&J vaccine, which highlights a well-resourced science, technology and innovation system. This isn't the only well-developed industry. However, funding is diminishing. And joining us now to discuss this, we've got Dr Glenda Kruss, who's the executive head for the Center of Science, Technology and Innovation Indicators. Dr Kruss, good to have you. Thanks for being with us on the program.
Thanks, Leanne, because this is a subject very close to our daily concerns and passions, so we're very pleased that it's coming into the spotlight.
Well, I must say, I mean, it's become a conversation close to the hearts of all South Africans now because, you know, of living through a pandemic, understanding the science behind everything and wanting to be at the forefront of it because, you know, we see the advantages of that, particularly at a time like last year and this year and where we're at now. So talk to us about what is meant by South Africa currently benefiting from past investments made by the Department of Science Innovation in research and development?
Okay, so Leanne, what we do is every year we measure the R&D expenditure and performance and personnel that are available for science, technology and innovation in South Africa. And it's important that we have our capacity of our system and then our systems ready across all our disciplines and across all our institutions. Because R&D is importantly done counter-cyclically, so we can't wait for something to happen or go wrong like COVID and then suddenly start doing the research, because the research takes years and years to develop the capacities and the institutions and the people. So, for example, in South Africa, we were very ready with built-up R&D capacity in the CSIR and the South African Radio Astronomy Observatory, and we could rapidly activate that in the National Ventilator Project through innovating, and we could produce, for example, 20,000 ventilators between the outbreaks of COVID in March and December 2020 at quite a low and affordable cost for our country. So that's a vital example of having a system that's ready and why you need high levels of R&D. And at the same time, we've got, as you've mentioned, I heard in your intro, we need to R&D because we have to be able to perform. So we've seen the key role our scientists and researchers have played in the National Coronavirus Command Council. We've seen how important surveys have been conducted on the impacts of lockdown on people's daily lives and on livelihoods and on education and so on and so forth. And I think very particularly, and something we really are very proud of, is how our scientists have been able to map the genetic footprints and keep at the absolute cutting edge as the SARS-CoV virus is mutating. And that is based on R&D investments that have been taking place over a number of years.
So what has happened now that there has actually been a decline in R&D investment? I mean, just some of the stats. South Africa's total R&D personnel headcount declined from, I think it was 84,000, around about there, in 2017, 2018, to 84,036 in 2018 to 2019. How has this impacted the sector in the country?
Well, we are concerned at the decline in personnel, and in particular, it's important to understand different types of R&D personnel, whether it's researchers or technicians. So one of the areas we are flagging for attention is that we're having a steady decline in technicians, and that's very important for keeping all the labs and the research going. But one of the good signs is that we have we take a measure of how many researchers are there per 1,000 in employment. And South Africa's indicator is at 1.8, and this has stayed steady for about the past 10 years. So what we're also seeing is part of a decline in unemployment overall that we're all well aware of, but we are kind of maintaining a steady level of R&D personnel in the system.
And the thing is that you really would like to see more and more. Okay, we've spoken to the personnel, the decline in personnel. Look, it's not major, but you'd think at a time like this there would be more as opposed to less. But let's talk to the funding as well, because the R&D funding has been coming from the government via the Department of Science and Technology, but the department is calling for more investment. So again, if we look at a couple of numbers, it says that in 2018-2019, the Survey of Research and Experimental Development published this last Thursday, the gross domestic expenditure on research and development for that year amounted to 36.7 billion at the current rand value. This is a 5% decrease. So, from the 38.725 in the previous year. So talk to me about the slow decrease in the budgets.
Okay, so we are concerned, remembering that when we're measuring R&D in the country, we're measuring R&D that's performed in businesses, in higher education, in science councils, across government departments, and in NPOs. So that's a first important, and then we're measuring for a very specific year. So what we release now is for the year 2018-19. And if we recall, 2018-19 was a year of slow economic growth. Our GDP rates were largely negative in most quarters. There were a couple of quarters where there were signs of recovery, but our economy was slowing down. And we find that the biggest performer and spender of R&D is the business sector, and there was significant decline to lower levels than we've been recording over the past couple of years. And government R&D funding declined overall. So the whole climate for R&D investment was very muted at that point. And as we've just discussed, what's vital is that when there is economic decline, that we don't cut our R&D budgets, that firms and government departments keep up the levels of R&D funding, because that is one of the factors that can potentially aid recovery.
Yeah.
So we've done a bit of research with Statistics South Africa on the impact of lockdown on businesses, and we find that about 27% of business said that they kept their levels of R&D funding the same during the period of lockdown in 2020. But we find interesting trends. So, for example, smaller firms were a bit more likely to increase their R&D spend in that period, but large firms that have 250 or more employees were more likely to cut their R&D spend. And so that's the kind of message that our research is sending, that more than ever, government needs to maintain and grow its investment in R&D, as does the business sector, as do higher education and science councils and NPOs.
I want to talk about, the most topical issue at the moment is that of a vaccine. And we look at something, and we look around at other countries. And let's just use one example. We'll take the Serum Institute of India. We know it's a private company operating obviously in India, and it's manufacturing vaccines. It's exporting all around the world, and it's doing a pretty good job at something like that. Now, let's move this back to South Africa. We are not manufacturing vaccines. We've got the BioVac facility, which obviously, it's there, but it's still in its infancy of a public and private partnership. But, at a time like this is where you reap the rewards and the benefits of actually manufacturing or having the capability to manufacture your own vaccines. But this, of course, all comes with a lot of funding. Let's touch on this conversation. Do you think this is the route that South Africa should be investing and going in quite strongly? Because I think with the scientists and the caliber and capability we have, we could do this.
I think so. So when we look at science, technology and innovation policy, one of the key roles of government is to create the conditions for innovation. So we have long, since the 2010 decadal plan, we have long been promoting the bioeconomy and particularly the growth of biotechnology and nanotechnology, and the vaccine research and the vaccine manufacturing capabilities rely on that. So we have put money into the science and the R&D and the scientific capabilities, and we have put in some attempts to promote, as you say, BioVac is one of our success stories, but we need more of those success stories. And I think the challenge comes here, we have to talk systemically. So we're trying to promote a national system of innovation, and we talk public-private partnerships, but that's just one vehicle within a national system of innovation. And we need entrepreneurs and manufacturing capacity to come in and start entering the field of vaccine development. So that has been a bit of a gap in our entire value chain, that we haven't built the manufacturing capacity. But obviously COVID is giving a huge catalyst, and so now there could be space for public-private support and joint ventures and so on to grow that. Because, as you say, we have been doing some investment in the R&D over an extended period of time.
Yeah.
And our investment in health R&D has been growing steadily, so that it's now about 22% of our investment in R&D, of our expenditure on R&D annually. Well, that was in 2018-19. So we've got the investment, and now we need to be translating that into innovation and into growing an industrial sector around vaccines.
Certainly. I mean, if we look at something like, we've touched on BioVac for a little bit. We need to grow on that, and I think that's something we do know. But I mean, let's take Aspen, for instance. Obviously, this is now we're talking on the private sector, and the big news is that they are going to be working on the Johnson & Johnson vaccine, which is the preferred choice here in South Africa. I don't know what the number is as to how many we've already distributed here in the country. I think it's around about 12,500 or somewhere there. No, not even. No, I beg your pardon, 15,388. That's the number. Now, let's take Aspen. They are, whether it be in April, going to more package and distribute the vaccine as opposed to manufacture the vaccine. Is this the correct understanding? I mean, I'm putting you on the spot here a little bit. I don't know if that's the detail you have, but I mean, if we actually manufacture this vaccine in the country, I mean, that just shows you that this can be done.
Well, you are putting me a little bit on the spot, because
apologies.
One does have to do research into the kind of value chains and the sectoral innovation systems around these kinds of industries that we have. So we start having to bring in the Department of Trade and Industry and so on, and economic development. But I think it's, if you look at economic development strategies in other countries that have started to grow, like the Koreas or the Chinas, one of the strategies they do use is attracting foreign investment and then learning and building local technological capabilities through having somebody like Aspen manufacturing in the country. And then there's skills development that comes along with that. There's technology transfer that comes along with that. And then that can be grown into strategies where you be developing our own in-country capacity in that sector. For example, the manufacturing of the vaccines. So it can be a strategy along the way to developing capacity.
So my final question to you, and it just very quickly before I let you go, because we got to say goodbye soon. We look at HIV and AIDS, and obviously that was the lion's share of most of the R&D spending, I would imagine, to try and go in for research and the hope of a vaccine as well. But how has that declined? Because now, of course, this attention has been taken away completely on other issues and put into this whole COVID vaccine and the whole issue of moving ahead fast on this. So where do we still stand with HIV and AIDS?
Well, that's a difficult one to answer, and we would start seeing that potentially. We've already gone to field with the 2019-20 survey. So we might start to pick that up because it is one of the fields, priority fields that we track is expenditure on HIV/AIDS. We didn't notice anything untoward in 2018-19. But I think also on the positive side, we've got to remember that in the early days of COVID, we were able, one of our strengths is that we are able to have a relatively strong public health set of models and capacities that have been built up through the HIV/AIDS. And I think a lot of our vaccine capacity that we do have in universities, and we have some excellent scientists in universities, has come up through their work on the HIV/AIDS vaccine. So that's another example of spending R&D to be able to have capacity and readiness in the system.
Doctor. Yes, indeed. Dr. Kruss, I have to leave it there, but thank you. Thanks so much for talking to us. It's a very interesting and important conversation to be having at a time like this. And let's see how fast this grows, because let's hope that investment does keep coming in. Perhaps it waned, but after what we've seen now, let's hope that just grows and grows. Dr. Glenda Kruss from the Center for Science and Technology and Innovation, Innovation Indicators, talking to us about a decline in recent years into research and development in South Africa. But, as I was saying, Sakina, maybe it was perhaps leading up to this. I mean, this was obviously pre-pandemic that we saw the investment coming down. But perhaps now the importance is back on it. And I mean, we've seen our scientists have really stepped up to the plate and made some...
They always have, Leanne. I think it's more a case of under-reporting in this particular sector, because they have been doing some really fabulous work, some stunning innovations, because the department is now the Department of Science, Technology and Innovation, STI. So, they really are doing good work in that department, the various entities that exist. If you go onto the website of, for example, CSIR, you will see they have innovations there whereby they are at certain points looking for people to partner, or there's just so much happening that we don't necessarily are aware of. But do yourself a favor, go and look at those websites. It really is very interesting.
I got to stop there. We have to say goodbye once again. Goodbye. We'll see you tomorrow.